Key points from the study of niacin metabolism in the GeneBank and CardioLipin cohorts. United States residents overconsume the vitamin niacin due to voluntary supplementation and the fortification of staple foods with synthetic niacin. A survey of metabolites in 1,162 adults found the niacin metabolites 2-PY and 4-PY were associated with poor cardiovascular outcomes. The authors introduced a new analytical method to separate and measure these two similar molecules in blood samples. A new study tested whether the association with cardiovascular outcomes is reproducible with more accurate measurements. In this tertiary clinic-based prospective cohort study, 3,163 adult patients were recruited from vascular health centers in the United States or Europe. Participants donated a single blood sample at the time of enrollment and were followed for 3 years. The primary outcome was major adverse cardiovascular events, including stroke, myocardial infarction, and death from any cause. Both 2-PY and 4-PY blood levels were associated with increased rates of cardiovascular events, but the association of 2-PY was confounded by renal function, while 4-PY was not. Meta-analysis of genomes from 11,609 individuals identified a genetic variant associated with increased 2-PY and 4-PY levels. This variant was also associated with increased levels of the vascular inflammation marker, vascular cell adhesion molecule 1. VCAM1 was correlated with 4-PY in the United States cohort. In addition, human endothelial cells expressed more VCAM1 protein when exposed to 4-PY. Adult female mice also expressed more VCAM1 when exposed to 4-PY. Mice treated with 4-PY also showed higher rates of white blood cell adherence to blood vessel walls, an early stage of atherogenesis. We concluded that in at-risk adults over 50 years old, the niacin metabolite 4-PY is associated with increased vascular inflammation and increased rates of cardiovascular events. Experiments in mice and human tissue support the hypothesis that 4-PY directly causes vascular inflammation. Full trial results are available at clinicaltrials.gov and the German Clinical Trial Register.